Welcome to the School of Nursing and the Clinical Learning Center. There's a basic assumption that goes with the philosophy of simulation education. We believe that everyone participating in activities at the CLC is intelligent, well-trained, cares about doing their best, and wants to improve. Simulation education is built on a very cool philosophy of experiential education. It's a holistic approach where faculty choose experiences for students and learning happens through reflection, critical analysis, and synthesis over time. It's holistic because it draws on intellectual, emotional, social, political, spiritual, and physical engagement. There is uncertainty, so success, failure, adventure, and risk-taking are part of it. But it takes place in a community where there are supportive relationships for this learning.
There are multiple simulation modalities that are used in the Clinical Learning Center that students will have the opportunity to experience. These modalities range from high fidelity and high complexity to low fidelity and low complexity. Technical difficulties can and do occur sometimes in the Clinical Learning Center, which may require the learner and the faculty to be flexible in their approach to simulation. First, we will talk about task trainers. One of the first task trainers developed in 1960 was Resusci-Annie, which was introduced to teach cardiopulmonary resuscitation. Today, a wide variety of trainers are available to practice airway management, vascular access, paracentesis, lumbar puncture, and many other tasks. These task trainers allow learners and professionals to practice specific tasks and technical procedures without harming or hurting an actual patient. Another modality is standardized patients, also known as SPs. This modality is used mostly to teach and assess individual clinician or student competencies. Standardized patients are volunteers or paid actors trained and scripted to portray a character in order to add realism and provide additional challenges to the learner. SPs can also play non-patient roles, such as distraught family members or another healthcare team member that can distract the learner. High-fidelity simulation is the most widely known modality, which uses high-fidelity mannequins primarily for training and assessing healthcare teams. Depending on the model, these computerized mechanical high-fidelity mannequins represent patients at various developmental stages and are used for different purposes, including birthing simulations, medical emergencies, and trauma care. Lastly, virtual reality and computer-based simulations allow learners to become immersed in a computer-generated environment with individuals or groups. Learners interact with the virtual reality patient by asking questions and by performing diagnostic and therapeutic actions. All of these modalities are used in the Clinical Learning Center and are chosen based on the objectives the faculty have determined.